So now we're going to go 11 by 14 crosswise. 14 by 17, thank you. So you can start at the bottom or the top. It just depends on what position you're doing. One thing about the top, you've always got the armpits to gauge your top of your cassette, right? You might have trouble feeling for the sternum, but you want to include the diaphragm so we get the flexure, so put the light at the armpit for most people. Just like we did the upper abdomen before. So here's her iliac crest. So I'm getting just slightly below her iliac crest, but I'm getting the upper diaphragms, flexures and the transverse colon here. Now, one trick that you can use, and this is even when you're doing your abdomen films, this came up at film critique last week, is when I'm doing a really large patient, I want to make sure that I overlap a little bit of the abdomen. One thing you can do is I would either take a pen, I don't have a pen on me anymore, and write on the gown, put a line, or just put my finger here where the light is. Okay, and then when I go to do the lower abdomen, I'm going to make sure that my light is still on my finger. So that way you're showing overlap without, because somebody did an abdomen they were showing me, and they had done actually 3, this patient was huge, they were 500 pounds. They had done 3 abdomens, but they had they really had only moved the cassette, about 4 inches at for each center, so they really never even got the diaphragm in the 3 films they took. Because the patient was so large, they were having a hard time, they couldn't feel anything as far as landmarks. Sometimes you can have them bend their knees up, and if you kind of see the fold, but that can be deceiving if they've got the apron of fat that goes all the way halfway down their knees.
That's what happened.
Yeah. And this lady had like a large and a small bowel obstruction or dilation anyway.
Sounded too much eating.
In very rare instances, we actually have to do 4 quadrants. 1, 2, 3, 4. But in most cases, you can just do upper and lower crosswise and you'll get it.
Chew your food.
Okay, so now that's my AP. So if I'm going to do my obliques, go ahead and turn up towards me. Roll back. Now remember, for larger patients, you don't have to put the sponge behind them as much. Some of you are having trouble with your rotation because you put the sponge in too far, and then that puts them up too far. Okay? Because they've got the extra back here, so you don't need to put the sponge in as much. Okay, so now I know I'm already at the lower pelvis. I'm just going to recenter the abdomen. So you have to sort of smooth down the side and center. See where my thumbs are? My thumbs are like at her MSPs. So if you look down from the head or the feet, I'm right in the middle. Do you see that? MCPs?
CPs.
I'm sorry. I'm thinking of MSP here. So my thumbs are at the MCPs. And so the light is just a little bit off her MSP. But what you don't want to do, so you're going to smooth it out here so that you're fairly centered to the abdomen side to side. What you don't want to do is center too far this way and obviously clip some of the anatomy because the intestine is going this way. Or center too far this way and then miss the flexure, which is what we're going to get up here. So you don't want to see light like this. You want to just kind of imagine, and when you go on the upper part of the patient, find their ribs, the bend in their ribs. I don't know that we'll have this problem in this lab, but there are a couple people in the morning lab that are going to have to do crosswise films because their patients won't fit. So now see how I'm centered right down the middle of her abdomen? So I've got the lower, so now I just go to the upper and see how the light's at her armpit? Okay, so what am I demonstrating in this position? The left colic flexure. So I want to make sure that I've got the light here where I can palpate her rib.
Let's just go armpit everything then.
Well, for the uppers, yeah. But side to side, you still want to make sure. See when I push in, I can see light.
And the light is there on.
Yeah, see when I push in, see where my hand is?
Yeah, okay.
The light's on my hand, right? Because this is basically fat. It's not going to be where abdominal tissue is going to be. But there is going to be some distension of the bowel. So what I'm saying is you don't want to just center way over here and forget that there's going to be bowel on this side too. The purpose of doing the overheads is to get the entire colon on an image. The doctor's already done their individual areas of spot filming. Okay? So like, I don't know, put your arms up, let me see you. Like, you know, I might do crosswise on him upper. He's small on the waist, but he's got a wide chest, which means his colon might be wide on the top. I won't really be able to tell until you're on the table. But
I'm sorry, go ahead.
3 of the guys this morning, Enam, Oscar, who was the other one? Who? Oh, and Steve, were wide enough to where we decided to do maybe crosswise, and then Nicole for the females. So you really don't know until you get them laying down. So you want to make sure it's center so that you've got the abdomen right in the middle. Like that. So who had a question?
Oh, no, I did. I was just, because you moved her right now, but on the obliques, isn't it safe to say that the crosshair is going to be aligned with the ear, just like on most of the exams?
Probably so. Although, well, see, it's not really on her ear for this one.
Well, it was before you moved it, but
well, because
so
it was in the wrong spot. Yeah.
Oh, shoot. Okay.
Okay, so see, as I push in, see where my thumbs are here?
Because you pushed in, you had to move the light. I see what you're saying.
Like that, though?
But, yeah.
With their food right there.
Well, I may not put my hand right here. I'm trying to go here at the. But good point. Stay away from the breast.
Well, it's everywhere.
Okay, so.
Then just use this side as your gauge. Okay. See, when you press in, see how the light's just going to skim your hand? Because this is, you know, a little more soft tissue than I wanted, but, you know. Hello. I know. But, you know, we get them where they're...
That's what we're dealing with, yeah.
So
American.
you practice...
America.
But also remember, the light looks smaller here because it's this far from the image receptor. It's going to be divergent by the time it gets down to the cassette. So the bigger the patient, the smaller the light's going to look like.
90 at 600.
What was the technique used on that?
90 at 620.
620 mass at 92.
Oh,
Some
S number was 400.
some
Wow.
tubes can't even handle that. But, I mean, that's a rarity. But I will show you some films today where we have patients that have like a enlarged colon called megacolon, and you have to get all the colon on there, so you have to image it with the.
So if it's a regular patient, it's gonna be the same technique as the one that we just UGI, right? The small bowel.
Well, if you're doing an air con VE, it's usually around 90 kVp.
Mhm.
Single con is around 100 to 110. So it would be similar to the upper GI.
Okay.
Okay, so what I want to show you, the reason I'm having you do crosswise is here I'm centered at her iliac crest, and this is...
That doesn't sound cool.
What's interesting is
So this is 14 by 17. So if I only tried to do this lengthwise, do you see how it looks like I'm going to cut off a lot of tissue over here? Mm-hmm. That's why I wanted you to do 2 crosswise. Because I really don't think on her...
Even with the being divergent.
Because, even with the divergent beam, we're still going to lose some of the colon here. So if you happen to have a hyperstenic patient, you may have to, or not hyperstenic, but slightly hyperstenic, you may have to go ahead and do crosswise. So for the students that have to do 2, I want them, if it says for flexure, then I want to see how they're going to center for the upper abdomen.
Okay.
Right? Because that's where the flexures would be. Because if you can do this, it's simply a matter of just moving your cassette down, or your light down. Yeah? So it's boom, 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 boom. So males and large patients are harder to do VEs because you just have so many more images to take. But those are usually the patients that need the VEs. So both males and large patients.
Oh.
Males that are large.
Yeah. And there you go.
You have the combination.
Well, you know, obesity can lead to cancer. Mm-hmm. And so that is a higher risk of cancer, colon cancer, when people are, along with many other health problems. Okay, Miss Rodriguez Gonzalez Smith. We're all done.
We need to be done real soon, otherwise I'm going to fall asleep on the tape.
Okay, so questions? Yeah, take your break then.